My name is Tracy Johnson, and I'm 34 years old.
Wakia Shantrice Lucky, and I'm 35.
My name is Terrence Jewel Carpenter. I'm 39.
My name is Geneva Cochran, and I'm 53 years old.
Dallas Palmer, 43 years of age.
Michael Cole, age 30.
It's kind of interesting though, because I kind of always felt that something was wrong. So it was a surprise, but at the same time, it almost wasn't.
It all happened in 2002 of September. That's when my kidneys failed, and that's when I started on dialysis. 2002, I was 23, and I've been on it for 11 years.
I really didn't know much about having renal failure, and so I can't exactly say I had a feeling until I started learning more and knowing more about what I was dealing with.
They basically said your body's shutting down, you're in end-stage renal failure, you need a blood transfusion, you have pneumonia in your right lung, and you're dehydrated.
I was having major migraine, seizures every month. Then I had a blood clot that burst in my head. This will cause the seizures.
Depression tried to come and set in, but I wouldn't allow it. I just, continued to do everything that I needed to do with dialysis and taking medicines.
If it is in their genetic makeup that they do have diabetes or hypertension and they're going to develop kidney disease, unfortunately we have not reached a point where we can reverse it. However, what we can do is slow it. And I think a big part of this is educating our patients, especially in this population, in where we live. A lot of our patients carry the genetic risk factors. Their parents, grandparents, everyone around them and their families is either diabetic or hypertensive, and these are the two greatest risk factors for chronic kidney disease and further for developing what's called end-stage renal disease that would require either dialysis or a transplant.
When they called me and told me that they got one for me, I was excited. It was like, a dream come true for me. Since then, I've been feeling wonderful, blessed, happy, excited. I got a second chance in life.
Without a good support system, I don't see how I would have overcome, because it's very stressful, it's very demanding, and I'm just glad my wife was there.
It took a lot of strength, to be a young wife, a young mother who was also working, trying to take care of a sick husband and kids at home. It was very hard, and I have God to thank for my strength, because with him being sick and me not knowing a lot about renal failure, I had to go to God for comfort.
Will be 2 months on the 29th of October. So I got my transplant on August the 29th.
All I can say is pray, keep pushing, because you will eventually get a transplant. Because the stuff I went through, I'm blessed because I've been through it all. I had numerous of surgeries on my stomach, from my head to my face. All I can just say is pray and ask God to bless you, because he will bless you.
Through prayer and faith, you can make it. That's what I had. I had just a little prayer and faith, and it made everything all right.
Be patient, be positive, and be prayerful.
I really didn't think about whether mine would go out or not. I was a little nervous, but excited to be there for her.
Well, honestly, after my uncle asked me and I went to be tested on the drive back home, God just simply spoke to me and told me I would be the one. And upon him telling me that, I just said, okay. And basically that was through everybody else being tested, I came to find out that I actually was compatible.
We had to go through a kidney swap program and registered through the National Kidney Registry. And it was just a little pool to where, you know, if you weren't a match for your potential donor then or recipient, you would have to go into the pool and be a match to another recipient.
Pray first. Always consult your spouse if you have one, or someone that's really close to you, because everybody doesn't agree with transplants. Some don't want them to participate. So I would say always, pray, consult God first, and then make sure it's okay with your spouse.
He is doing absolutely great. Just to see him back to his normal self lets me know that this process that I went through was worth it. And I thank God that I was just simply around, and that he even allowed to use me to be a vessel for such a time as this.
Do not give up. Just keep the hope and keep yourself prayed up, and everything will work out fine. Get yourself registered in a lot of lists, and just keep yourself posted and keep yourself informed on what's going on out there as far as kidney programs and surgeries and everything.
Going to the doctor regularly, especially if you have a family history of diabetes and hypertension, and keeping an eye on your blood pressure and your blood sugars will go a long way in hopefully delaying, if not completely preventing the onset of chronic kidney disease.